Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome everybody again to another episode of our show, bringing you another really fascinating guest today involved in creating a better tomorrow for so many people. Today we have the honor of being joined by Dr. Ahmed Ogwell, who is the acting director of the Africa Center for Disease Control and Prevention, also known as the Africa CDC, a specialized agency of the African Union where he works with various African Union member states and other partners, leading teams of experts in securing Africa's health through effective preparedness, early detection, and rapid response to disease outbreaks and public health emergencies on the continent of Africa. Dr. Ogwell has over 25 years of experience in public health as a social and developmental agenda at the national, regional, and global levels, and has held senior positions in national governments, the United Nations system, non-governmental organizations, and the African Union. Dr. Ogwell previously worked as an advisor to the World Health Organization, Director General, also worked at the WHO Regional Office for Africa. He's originally from Kenya, started off his career founding the Office for International Health Relations and the Department for Non-Communicable Diseases at the Ministry of Health in the Republic of Kenya. He is also recognized for leading the negotiations for the Tobacco Control Treaty, contributing to the implementation of the WHO Framework Convention on Tobacco Control across the African continent. He is an alumnus of the University of Nairobi School of Public Health and the Center for International Health at the University of Bergen in Norway. We're extremely honored to have him with us today. Dr. Ahmed Ogwell, welcome to our show today.
Well, thank you. Thank you for having me.
It's an honor to have you, and I would really like to go right into it by starting out just talking a little bit about Africa CDC and your leadership role as acting director. We've, as I mentioned before the show, we've had some guests on from United States CDC, but your role is a little broader in the sense that you have about 55 member states that you have responsibility for. Talk a little bit about the organization and a little bit about your current role, if you would.
No, thanks. So Africa CDC is an autonomous institution of the African Union. This new status was granted in February of this year by the Assembly of Heads of State and Government of the African Union. And it means that we then have our own systems to be able to design our operations and response here on the continent in as far as health security is concerned. The institution was launched on the 31st of January of 2017. So we're just about 5.5 years old, punching way above our age because of the multiple health emergencies and disease threats here on the continent. Since inception, the Africa CDC has taken its role for disease prevention and control very seriously. And for an institution that is technical in nature, we are housed by a political organization, the African Union. This is a very unique mix, and I cannot think of any other organization that has this kind of arrangement globally. So we are charged with the responsibility of handling health security matters on the continent of Africa on behalf of all the 55 member states of the African Union. What we do is to use evidence to support capacity building of institutions, of governments, of individual experts, so that we are better prepared whenever there is any health outbreak, so that we are able to respond effectively and quickly whenever we are called upon to do so. So Africa CDC is very unique in that sense, and a young organization at the same time, but doing some phenomenal work here on the continent of Africa for the benefit of the continent and also for the benefit of the whole world, because health security is really a global issue. Thank you.
Excellent, excellent. And you know, it's one of the recent papers that you published. This was in the Lancet Infectious Disease back in February 2021, which was entitled "Genomic Informed Pathogen Surveillance in Africa: Opportunities and Challenges." You worked on this with Dr. Nkengosong, who is now advising the Biden administration here in the area of HIV. But this paper deals with something that's a very important component of the Africa CDC, your new Institute of Pathogen Genomics, talking about, as you were just mentioning, 55 member states, disease outbreaks of various types across the continent over the years, whether things like Ebola, TB, HIV, and so forth. Yet, at the time, sort of one of the things you highlight in the paper is that very few of the countries had sort of this formal sort of genetic sequencing ability to look at some of the diseases, but also this area that we've been talking a lot about on the show and recently, One Health, sort of this connection between humans and sort of the natural world and sort of spillover events. Talk a little bit, if you would, about this paper, of course, but also the Institute for Pathogen Genomics. I think it's a very important new initiative.
We launched the Institute for Pathogen Genomics way back in 2019, before the pandemic.
Right.
And our ambition at that time was to bring this new tool into our surveillance activities on the continent. Pathogen genomics, when we sequence each and every pathogen that is affecting our health security here on the continent, the pathogen better, its origins can then be able to also be traced, and of course, how we can be able to deal with it, its weaknesses, its strengths, how we are able to define them. So when we launched the Institute way back in 2019, before the pandemic, we really wanted to strengthen our member states' capacity to use this new tool of a new generation sequencing, and also to be able to utilize the information that we will be getting out of pathogen genomics processes. Little did we know that we were on a path that was going to make a huge difference during the COVID-19 pandemic. So fast forward to the pandemic has caught a lot of steam in the early parts of 2020. Our first case here on the continent of Africa was on February the 14th of 2020 in Egypt. And immediately we went into the mode of how do we utilize every capacity that we have at the Africa CDC. And the Institute of Pathogen Genomics was one of those capacities that we had started and we wanted to expand. So what this institute has done over the last 2.5 years is just phenomenal. At the beginning of the pandemic, we had just about a handful of countries, maybe 3 or 4, that could be able to do on their own resources sequencing. But when the pandemic hit the continent, and we knew that because this is a new pathogen we were dealing with, we knew that viruses usually change their nature, what we famously now call variants. We knew that this would come. The variants would come, the subtypes would come, because that's the nature of viruses. So we decided, let us use the Institute of Pathogen Genomics to ensure that our African countries were ready or had access to new generation sequencing. So from a handful of countries today, at least 48 of our member states can be able to do, sequencing within their own countries. That is the level of expansion that we have had in a very short while. In fact, if you look at the period April to December of 2020, that is where most of our work was done. It was done in the middle of lockdowns, and it is just phenomenal work. Part of the reason why we decided to pen that particular paper to just secure the key work that we've been doing within the pathogen genomics space. Finally, in this particular area of work, as Africa CDC, we've also built our capacity. We are not only building the capacity of our member states, which was good work, but we're also building our capacity internally. We have the Africa Pathogen Genomics Initiative, which has brought together many dozens of different institutions and private sector companies together to be able to build on the work that we began at the beginning of the pandemic. And the Africa Pathogen Genomics Initiative is now growing. We are training. We are ensuring that equipment are available at country level. We are ensuring that consumables are available. We are ensuring that bioinformatics is a strong part of the expansion at country level, so that we can be able to, decipher what the sequencing data means for a country, means for the continent. And we are also contributing to the global architecture when it comes to pathogen genomics. So we are very proud of the work that we've done in pathogen genomics, and we are looking forward to it contributing to other outbreaks, other epidemics and pandemics that may be able to come our way.
Outstanding, really outstanding, and amazing the sort of the speed and scope that initiative grew. So I appreciate you sharing that. Dr. Ahmed, another sort of initiative of that scale, and I've seen that you've been on a lot of sort of health tech, health innovation conference circuit lately, but it has been sort of in the area of how health tech, digital health, artificial intelligence, some of these novel tools are extremely important in public health, building resiliency. Africa CDC just a couple of weeks ago had a press release about a collaboration with a group called Smart Africa, which seems to be an alliance from the different countries on basically digitalizing Africa in many different ways. Talk a little bit about how these tools, are also very sort of important and beneficial in Africa CDC mission.
Yeah, let me start by sharing the good news that as Africa CDC, we're actually developing our digital health transformation strategy. We believe very strongly that using technology, we are going to be able to shorten the time it takes us to know that there is an outbreak somewhere or a health emergency. And by using technology, we are going to be able to bring it under control faster. So this is very clear for us that we are on the right path. And that's why we have the digital transformation strategy in the process of being developed. When we are doing that, we are using a very important vision that we have called the new public health order, which has 5 pillars. The first is strengthening our institutions of the continent. Second is strengthening our health workforce. Third is local manufacturing for everything that we need in the health emergencies. Fourth is using domestic resources before we can be able to engage with partners outside of Africa. And fifth is partnerships, bringing together partners, because we know we need to do it on our own, but we don't want to do it alone. If we do it together, then it means that we are benefiting the whole globe in a more holistic way. So as part of our digital health transformation strategy, we are bringing into the space of digital digital work, similar organizations, and Smart Africa is one of them. Mm-hmm. We signed an MOU in the sidelines of the UN General Assembly back in September, and we want to use their strengths to support our work in digital transformation within the health sector. we want to use their networks. We want to use their experience to be able to support the work which we are doing. We believe strongly that by using technology, particularly the modern one of the AI type, we are going to be able to get our outbreaks to be smaller and to last for a shorter time. And that's why we are always looking for partnerships that are going to help us in achieving this vision of the new public health order. Now, one thing that is very important about Smart Africa is that it's an African institution. Its membership, its areas of work are here in Africa. And although they do digital work in general, we are interested in the health portion. And that's why we've come together and signed this MOU to be able to leverage our individual strengths as institutions and then deliver that to the benefit of the African continent and the African people. We believe strongly that if we want to move faster in identifying outbreaks, if we want to move faster in responding to those outbreaks, if we want to move faster in generating the relevant health products that are going to be used in preparedness and response, then we need to go digital. And technology is a friend when it is used well.
Excellent. Dr. Ahmed, I mentioned in the introduction that you're, in addition to infectious diseases, digital health, you're extremely well known for your involvement in the Tobacco Control Treaty. You've published extensively, sort of in areas of tobacco control. And there was another paper that I noticed in 2018. You sort of outlined the progress in the area of tobacco control research for the past 50 years. And you introduced in this particular paper a theme of the research desert. There are certain areas, like in this particular case, sub-Saharan Africa, where we need more effort in this because we've made progress, but still this is a major killer. And at the same time, obviously, in many countries, a major driver of the economy. Talk a little bit about sort of in 2022. I mean, you have a lot of responsibilities on your plate, but bring us back to tobacco control for a moment and some of the initiatives that you're envisioning there from the perspective of the CDC in Africa.
Yeah, but my public health life started in non-communicable diseases.
Right.
And, the two sides of the non-communicable disease coin, the primary prevention where you have tobacco, alcohol, diet, physical inactivity, and the other side of the coin where you have all the diseases, diabetes, hypertension, cancer, and all the other chronic illnesses that are brought about by the NCDs challenges globally. So when I started in NCDs, for me, it was very clear that we need to be preventive. It is like that river. You are seeing people drowning and passing. So I asked myself, should I be busy pulling them out of the river? And that is being a good physician, a good surgeon, or should I be downstream preventing them from jumping into the river? And for me, it was really a no-brainer. I said, no, I don't want to be fishing people out one by one. Some half drowned, some already drowned. Let me go and prevent them from jumping into the river. And that's how I went into primary prevention. So tobacco control, alcohol control, diet, physical activity, these are the primary areas that I went into public health through. One thing was very clear at that time and still is now, and that is the dearth of data, evidence. There's very little of that being generated from the African communities, from the African situations by African experts and researchers. So for me, and when I penned that paper back in 2018, it was very clear that if we do not generate our own evidence, then it is not easy to convince our policymakers to make change. And that is why, even at that time, way back in 1998 or thereabouts, we were encouraging our African researchers to generate local evidence, even though we know tobacco is injurious to health, to the economy, to society. We said, let's generate evidence from within Africa, within African communities, using Africans as really the tools of passing this research message. And whatever we generated and placed on the table of our policymakers, it made a very big difference. And that links very closely to what we are doing now. I am still downstream preventing people from jumping into that river of health emergencies. We want to train our people so that we have early warning systems in place. For example, community health workers, if you train them well, you give them the right tools, they're the ones who will tell you that there is a new illness that is being seen in the community. It will be your early warning system. Before the lab can be able to pick it, you will have gotten from the community that there is something new, something different that is happening at community level, and you can be able to respond fast and contain it within that community. Otherwise, if you wait for it to pop up in your referral hospitals, it means a lot of people will have gotten exposed to whichever disease entity that may be. So when I look back on my tobacco control days, my NCDs days, and I look now, the difference is just the terminologies that we use. Mm-hmm. The difference is in the emergency nature of cholera or Ebola or COVID, but it is exactly the same situation when we're looking at it from the angle of diabetes, of cancer, of heart illnesses. It's just the amount of time that it makes you reach the actual disease entity. With infectious disease, it is quick. With non-communicable disease, it is slow, but the environment is the same. We must stop people from jumping into that river. And so I link, and even the experiences that I had with the negotiations of the WHO Framework Convention on Tobacco Control, I bring it now, negotiating for new instruments for supporting health security on the continent. I bring it now to negotiate with companies that manufacture vaccines and diagnostics so that we can be able to access it more easily here on the continent. They are very, very closely linked, and I'm really glad that the space of public health is appreciating more and more that non-communicable diseases are just as much of an emergency as COVID, as Ebola, as cholera is.
Absolutely. Doctor, could you please say a few words about a recent paper that you published? It was entitled Urgent Need for Non-Discriminatory and Non-Stigmatizing Nomenclature in this paper for monkeypox virus. Could you talk for a couple of minutes about this theme? Because I think in a world where the last couple of years we've seen many emerging pandemics, this whole concept of, we don't normally think about it, but there is a component of discrimination, of stigmatization that comes along with these conditions. And I'd like you to say a few words about why you published this paper.
Absolutely. You know, the stigma begins from what the disease is called. And when you have a disease condition that has been given a name that is open to stigmatization, like monkey and things like this, it becomes a problem for people to come through and say, I have this illness, simply because of the name. But we are in charge of naming these disease conditions. We are in charge of naming the viruses and the bacteria and other parasites that cause us illnesses. So it is upon us as responsible experts to ensure that the name that we give to any pathogen, the name that we give to any disease condition, does not result in stigma of either the individual who has it or the place where it was first characterized. We must get neutral names that are going to make it easier for us to be able to engage. Beyond monkeypox, even today, when you look at Ebola, we have strains that are called Zaire strain, strains that are called Sudan strain. We are already linking a whole people with a virus. It is not correct. We must destigmatize the way in which we name our pathogens. We need to destigmatize the way in which we name our diseases, so that when it comes to the time of intervention at community level, we do not find it difficult to be able to address some of these outbreaks in a humane and non-stigmatizing way. So it is our position We penned that particular paper very clear in our minds that if we do not change the way in which some of these viruses, bacteria, and other pathogens are named, then we are going to find it difficult to be able to get the community behind any intervention that is going to result in better health for that community, and of course, by extension, to the global health security architecture. We need to destigmatize the names first, even before we go into how we are going to deal with a particular outbreak or a particular illness.
Wonderful. Dr. We're coming up to the time limit of our discussion today, but I just want to one last thing for wrap up. We've talked about public health, innovation, non-communicable and communicable diseases. Any other things coming up for the remainder of 2022 as we enter 2023 per Africa CDC that you may want to announce on the show today, or mention new conferences that you're going to be presenting at, talks you're going to be giving? Please take the floor as we wrap up the show.
No, thanks, you. And I would like to say three things. One is on the 13th to the 15th of December this year, we are holding the second edition of the Conference for Public Health in Africa. It will be in person in Kigali in Rwanda. And if you go to the conference website, and that is cphia2022.com, you'll find all the information that you need, and it is in person. And we want to see you there at the conference. This is one. Second is the Africa CDC, after being granted autonomy, is undergoing a transition. And we are engaging differently with our member states. We are engaging differently with our partners. And in the next 3 or so months, by the end of the year and into the very early part of 2023, we are expanding the understanding of our vision, which is the new public health order. And we will be unpacking it very progressively. Please do visit our website on a regular basis and our different media platforms. We want to unpack what we mean by the new public health order, how it is going to change the way in which health security is going to affect not just Africa, but also the globe. And it's also going to, we're also going to communicate the plans that we have going forward in implementing the new public health order. Finally, is to say that COVID-19 is still the reality of Africa. And because of low vaccination rates, we are right now doing mass campaigns, door-to-door campaigns for vaccination. And this is one area that is going to be very important in the remaining weeks of this year, so that we can be able to get as close as possible to the 70% that we've set ourselves as a target. And so for all those here in Africa, we ask you to go out and get vaccinated against COVID-19 so that your holiday season may be safe, not just for yourself, but also for those around you. Thank you.
Outstanding. For everybody that is going to be listening to this episode of our show across the various podcast networks or watching on the YouTube channel, again, you've been listening to Dr. Ahmed Ogwell, Acting Director, Africa Centers for Disease Control and Prevention at the African Union. Dr. Ogwell, I want to thank you for taking the time out of your schedule to come talk to us for a little while today. Obviously, thank you for everything you're doing there in Africa. And as we say on our show, thank you for helping to create a better tomorrow for so many people out there via what you do. Very inspiring story.
Thank you, and it is my pleasure.